So now you may be wondering, what should the environment at the patient's end look like to ensure that you can conduct your telehealth consult effectively? That varies depending on what kind of specialty you are in. If you're a psychiatrist or psychologist using telehealth, you don't need nearly the same amount of space as if you're a specialist like an orthopedic surgeon, a pain physician, a musculoskeletal physician, or anything that is physical based. If you are needing to examine an individual's injuries on their person, if you are needing to look at gait, if you are needing to look at movement and bending and stretching and all of those kinds of areas, you will need to make sure that the injured person has enough space and that the camera or the laptop is positioned in such a way that you can observe the person and their movements. If the physical environment is not set up that way, you will need to ask the injured person to change the room setup. You will need to observe the person to effectively provide your medical opinion. So feel free to ask the individual to change the environment so that you can do so. If they are unable to do that and you are not able to confidently assess the individual, or if there are aspects of the consultation that you're not able to confidently assess, you need to make mention of this in the report. It is okay if you cannot continue and you need to abort the consultation. If there are just aspects that you can't continue, please make a note of that in your assessment. So the first thing is environment. Make sure that that is fit for purpose for the consultation that you need to do. Secondly, privacy and comfort. And that comfort and privacy also doesn't just relate to physical but also emotional privacy and comfort. If an individual's been through a traumatic event, the last thing you want is to have multiple people around. Make sure that they're in a quiet, private place without other people around. The third component revolves around suitable use of equipment. And what I mean by that is making sure that there is adequate light or little or no background noise, making sure there is distance for the best use of camera. As previously mentioned, if you need to ask the individual to modify something about the environment, please feel free to do so. What is of utmost importance is that you can confidently and competently assess the individual so that you can make a determination and provide your medical opinion.